Good morning, everyone. Happy Tuesday, and welcome to our DCo Talks 2.0. What month is this? July session. We are talking today about men's health. Our title is Improving Men's Health and Bringing Men Together to Learn, Move, Train, Present, Volunteer, and Inspire. We're grateful that everyone is here and taking time out for this opportunity to learn about this important subject and how Durham County is working in this space. My name is Dawn Dudley, and my coworker and I work together each week, Alicia Watson. We work together each month, rather, to bring forth these sessions and interesting topics. And we always invite your feedback all the time and hope that you'll be able to give us some suggestions on future ideas. This is actually one that's come up before, so we are thankful for everyone who's able to show up today. Just to give you a little bit of background if you're not familiar with DCo Talks, DCo Talks 2.0 is called that because it's been revised over the years as been a part of our programming offered by the Public Information Office in Durham County. It's an employee-led program designed to foster connection, conversation, and community among Durham County government employees. Sessions provide a welcoming space for employees to share experiences, exchange ideas, and engage in meaningful discussions. Again, thank you so much for being here this morning. Alicia?
Yes, hi. As Dawn has introduced me, I'm Alicia Watson, one of the other co-facilitators of DCo Talks. I just want to give some quick housekeeping rules for this session. This session is being recorded. We record our sessions. So those who cannot make one of the sessions can play it back and watch it to get the information. We ask that you please mute your microphone. As a courtesy to the presenters. And if you have any questions, please hold off on them and post them in the chat. There's going to be a designated Q&A session at the end where we will get to your questions.
Can I add one part, Alicia? I apologize for interrupting. The recording, I don't think you said this. Once we record, we place it on YouTube. We, like you said before, we do record so anyone who missed it can see it later. But just want to let you know it's on our Durham County YouTube page.
And so I'm going to introduce our presenters from the Men's Health Council, which is a part of Durham County Department of Public Health. The work of the Men's Health Council is to improve the health of the men living here in Durham. They're going to talk about the program and some of the services available to the program. I'm going to introduce Joyce Page, who is an employee of Durham County Public Health, and the coordinator of the Men's Health Council, Jeffrey Ford, who's the facilitator for the Men on the Move walks, who works for Durham Parks and Recs, and the vice chair of the Men's Health Council, Bradley Long. So Joyce, I'm going to stop presenting and hand it over to you.
Thank you so very much. I'm quite excited to be here. Let me share my PowerPoint presentation. You all see that?
Yes.
Yes.
Okay, thank you. Again, thank you so much for inviting us. The Men's Health Council is one of the best programs I've ever worked for and worked with. Maybe it is indeed the best. We're going to talk about improving men's health by bringing men together to learn, move, and to be inspired. The presenters, myself, Jeff Ford, Bradley Long. The Men's Health Council is an organization of volunteers. I'm the only one that receives a check. Thank you very much, Durham County. Why are we focusing on, let me just go back and show you the men. These are some of the men who are volunteers. This picture was taken a few years ago, so we have several new members. The Men's Health Council is committed to reducing health disparities by actively engaging men who face the greatest health inequities by empowering them through connection, awareness, and action. Why are we focusing on the African American men? Because African American men have the shortest life expectancy of any group in the U.S. They have a higher burden of chronic diseases. Many have limited access to preventive care. Prostate cancer, which is the most common cancer in men, is the second leading cause of cancer death. And African American men are 1.6 times, almost 2 times as likely to develop prostate cancer. When they're diagnosed at a younger age than most men, and they often are at a later stage of the disease and have worse outcomes. And we don't know why this is, because prostate cancer is not linked to genetics, but we do believe that the lifestyles, health disparities make a difference, and not lifestyles that necessarily can be changed. Many of these outcomes are due to the pressure of being a Black man in America. African American men have higher rates of hypertension, twice as many strokes, 5 times as many instances of renal disease. They have more type 2 diabetes and complications. They also have poor control of diabetes. Reports on the mental health issues of African American men show that they are reported 30% more often to have mental health conditions than white men, and yet African American men are less likely to receive care. There are many barriers to care that might exist. This picture just indicates our first meeting, one of our first meetings. In 2014, I asked 10 men if they would come together and advise me on how to increase the attendance of African American men at our health promotion events. And we have these wonderful health promotion activities at the Durham County Department of Public Health. This is a picture of the men over a 1-year period or more. They planned, and here's one of the planning sessions. They planned, how can we get more men involved, and what do you want us to focus on? Those were the questions. And here are the answers that they came up with. They wanted to communicate with families and neighbors about disease. They wanted to educate and train, encourage self-awareness. They wanted to network, promote resources and local events, to evaluate the program's success, and to remove language barriers, the health literacy issues. So this is an organization chart. Durham County Department of Public Health is fiscally and administratively responsible for the management of the program. Overall, Durham County Department of Public Health has responsibility for the programs. Our volunteers with me carry out the program. Monthly, Jeff leads the Men on the Move walks, and that includes brief talks, and Jeff Ford is going to talk to you about that soon. For our year-round programs, we have forums, we attend health fairs to promote the program, we participate in research studies, focus groups. We conduct management workshops on disease management and prevention and falls prevention, and we do training. So several of our members have been trained 5 to 10 days to do a facilitation of these workshops. Why was this something I wanted to do? I worked in Hyde County, North Carolina, with a project called Project Direct Legacy for Men. We were again looking at how can we get more men involved. In Hyde County in 2004, 2008, they had the highest death rates from diabetes. They had a large male population, 51%, and they had a large African-American population. So that was an ideal location to go and seek the advice of men. And they gave it to me. They said very much the same thing that the men here in Durham said, that they wanted to have all these educational programs. And you see a picture there. We had more men come to a meeting on diabetes education than we were able to get in Durham County and in Wake County when I worked there. Also, this is a picture of women. We had an endocrinologist, diabetes specialist, come down and he did a presentation. And I wanted the men to meet separately because I thought men wanted to meet alone with each other and talk openly. Well, the women all came. They were in another room, they were in the sanctuary, and they let me know that this was not acceptable. They needed to be in there and hear the same thing that their husbands were hearing, or their brothers or their sisters, which is wonderful. So we never did that again. I never did that again. And the men said the same thing. I need my wife here. I need my sister here. I need my daughter here because they're gonna take me to the doctor. I need them to know what the doctor is saying because they are going to remember it because they help manage them. Very important to have women involved. So women are part of the Men's Health Council. Jeff and one of his friends, a colleague that were working on the program, said men need to move. They can't just sit around and plan. They need to be doing something active. So we had our first kickout walk in 2015. This was at Eastway Elementary, and you see Gail Harris and Michael Page leading the group, and Jeff is putting on his hood. It was raining, you all. We had NCCU's drummers come, and they led the group in the neighborhood. And they also had the African American Dance Ensemble provide background beats. It was a wonderful time. Sure, Jeff may talk to you about that more. We said, okay, let's keep going. Let's have forums. I said, I don't know any doctors right off that I could get to come. And Jeff said, I do. Eric Clayton happens to look like Jeff Ford because that is Jeff's cousin. He came from, I think, Wake County, Jeff, and he did a presentation on emergency room. When should you go to the emergency room? The walks began in that 2016, and they've continued. Initially, attendance was modest, but participants surely did enjoy each other. More forums are held. We continue to hold forums on a regular basis. The Omegas, you can tell from the colors there, hosted a forum on mental health, invited the community, and we worked with them. And they're members of the Men's Health Council. Anyone can be a member of the Men's Health Council as long as you agree with our mission. We had Dr. Coleman and Frank Nealon, Dr. Nealon from Duke, both of them are from Duke. This is a picture of council members. They did a forum, a symposium on faith, health, and wholeness, and talked about the Men's Health Council. This was not the location of the symposium, but the men came in to pose for a picture before. One of the best things biggest outcomes that we had, activities that we had, was the celebration of achievements of remarkable men. We had about 130 people come. We had Cedric Massachusetts, Cedric King come in. He's a double amputee and he's a triathlete. And we had the student Desmond Jackson from Hillside come. And they inspired us to carry on despite disabilities or challenges. And it was covered by the newspaper. Great program. That Cedric King was honored by First Lady Obama. More presentations. We did a forum with Duke. These shirts, which Jeff loves so much, his Men on the Move shirts, we were able to pay for those because Duke gave a donation in return for our helping plan and hosting a forum. And we've continued to receive donations. Most of the monies we receive are from donations. Dr. Arnett Coleman, who is a member, goes out into the community and does presentations. That's so important because the community feels comfortable. Here he gave a presentation at a Partners Against Crime meeting, and lots of people used to be his patients, and there they are. He couldn't help but run up to him. Okay, walks continue in 2018. Jeff added talks with the walks. Last year, we had a urology conference. We partnered with people, and that's important. We partnered with groups. White Rock we partnered with, and we got Dr. Lentz to come, a urologist, and he talked to the men about urological challenges. and we had about 65 people there. Duke asked us to be part of the roundtable discussions about involvement of the community. They asked one of our officers, James Tabron, to facilitate the meeting. Okay, we got a couple awards, or a few recognitions. The Sigmas gave us an award. The Durham City Council acknowledged us on a proclamation. And then here's a YouTube video. I'm not going to show it, but this is a link to the YouTube video that you can see. Steps Ahead, working with Dr. Julius Wilder and Duke. He wanted us to be part of this video and talk about how we are reaching the community, along with some other programs. We have some great men who share their wisdom on how do you keep men engaged. I'm going to skip through that. You can go back and review this if you like, because it is recorded. We do a lot of health fairs. One of the most touching things that we did was to do the presentation for Men's Health Month. Representatives did. It was called A Letter to Durham County, and it was about Black Lives Matter, the impact of racism, and acknowledge the deaths of George Floyd, Ahmaud Arbery, Breonna Taylor. It's more of the letter. We go into the Durham Housing Authority sites. We love our veterans. We appreciate them. So there's a memorial service. The Men's Health Council goes out and participates. This time at the memorial service, they were giving out acknowledgments to former Vietnam veterans, and two of our participants were there, and they are veterans, and they accepted their acknowledgement. Okay, our members conduct workshops. This is a Living Healthy workshop conducted at WD Hill, and you see men and women participate. They last 6 weeks. Jeff Ford is going to talk to you about the men's health screenings. They're done by Duke, and this is Jeff and other persons. They've been doing that for years, working with that for years. Jeff is also involved with the Healthy Mile Trail walks. This is one where he took the Men's Health Council on Fayetteville Street for a walk. And Jeff and those three men that are out front on the left, Jeff, Earl, and Earl, those are two Earls. They always are out front. But that's okay. Everybody else is real happy to join wherever they are. They love each other. They've come to know each other through the Men's Health Council. They check on each other. If someone doesn't answer their door, they will come in, and they've called me to see I can't get in contact with James or Willie. Where is he? And someone will connect and find out where they are. And that's Dr. Biola on the side with Willie. This is Dr. Julius Wilder, wonderful gastroenterologist. He does many presentations for us. He's donated for us. This is one of the early walks, and that Jeff and I and others are there at McDougal Terrace walking. This is one of the most recent walks. The attendance has improved significantly. I was worried about how I would get doctors involved, but our members bring their doctors. Last year, one of our members got his cardiologist to speak. Now, that's Bradley. That's Bradley Long. Bradley does many things. He's vice chair that's a men's leadership team meeting there. And Bradley has done presentations, webinars, sharing his experiences. He's talking there at one of our walks, presenting. And Bradley's got some moves I didn't know he had. There he's teaching the young lady in the back to do the hula hoop, getting us flex. These are our upcoming men's health walks. They're all held Saturdays 9 to about 10:15. And Jeff will talk to you more about that. Our conclusions are that it's so important to have these social networks and working with community organizations, that having health education at the community level, bringing the doctors and presenters and people who are sharing their stories, having makes a huge difference. People come out, they're comfortable. The networking has been fabulous. Folks want Jeff to do his walks every week. I don't think that's going to happen, but that's a lot of work for us. And we're glad. But Jeff tells you what people can do. I'm going to stop talking because I've talked long enough. I'm going to give you my contact information here. We would love for you to join us on a walk. We'd love for you to join us for any program and refer us. We send out our announcements to about 400 people a month. And we also are included with the information that the health department sends out, Alicia Smith, Communications, and Durham County. Thank you so much. Jeff, I'm going to go back so
All
they can
right.
see who you are at this walk.
Oh, all right. Well, thank you, Joyce, and thank you for having me today. One of the things that's happening today, I'm having some computer issues, so I'm not going to get on camera because I don't want to get distorted or for the computer to drop me. So please forgive me for that. As Joyce said, I'm Jeff Ford. I work for Durham Parks and Recreation, but I'm also facilitator of Men on the Move. Men on the Move is a monthly community walk in which we invite men as well as their families and friends to come out and join us for an hour on the third Saturday of every month from 9 a.m. to 10 a.m. However, those walks sometimes go a little longer because people want to stay around and socialize until 11 or 11:30. So, but technically we're from 9 a.m. to 10 a.m. Uh, One of the reasons I wanted to join the Men's Health Council was because of I had two brothers who I adored, older brothers, and they died prematurely from cancer. One died at 35 from colon cancer. The other one died from 61 from liver cancer. Neither one of my brothers drank, smoked. They were very great men in my estimation. They were family men. They loved the Lord. They did all those things. And unfortunately, cancer robbed us of two wonderful lives. So I wanted to be able to be a part of a men's health council where I could give back and maybe if we can do some stuff that's preventive, maybe we can help with some people's avoiding those type of pains that I experienced. Uh, One of the things I told Joyce when we first started was that if I was going to be a part of the Men's Health Council, we had to model healthy behavior. And one of the ways I decided that we were going to model healthy behavior was start Men on the Move. Uh, as Joyce showed you before, our first walk started at Holton Korean Resource Center, or excuse me, it started at Eastway, but we walked up to the Holton Korean Resource Center on the Healthy Mile Trail there. The reason why we chose that was that they were having a health fair. So the object was for people to walk then also go to Holton Korean Resource Center for the health fair and get whatever, get blood pressure screenings or get diabetes education, whatever the services that were being offered up there that day. We wanted the people who walked during that day to go and participate in it. Uh, but our first really initiative was to start the monthly walks happen like in 2016, 2017. Uh, the goal was to walk as a group on a monthly basis with our family, friends, or whoever you wanted to join us at a local park, a healthy mile trail. I thought it was important for us to be at local parks because a lot of people don't know the trails. They don't know their cities per se. So one of the things I thought was important was that we would be at a park and you can kind of see the trails that you have here, right here in Durham. You would be surprised how people says, Jeff, I've lived here all my life and I didn't know Lee Farm Park was out here. Or I didn't know about Merrick Moore Park. It's just amazing of what people don't know in their own cities. But now that we introduce them to their parks, they can go on their own with their families, their friends, or by themselves and walk in these fabulous parks to walk, to lower their blood pressure, to think, to meditate. All these things are the positive aspects of walking. So we wanted those things uh, come uh, come kind of generically after you start doing these walks. Um, One of the things reason I chose walk is because first of all, you could do it only in your neighborhood, so it's something easy to do. There's plenty of trails in parks and in state parks and things like that here within this Research Triangle area or within the Triangle area. Uh, you know, I always think about like having green spaces for myself. One of the things that when I have a very stressful day, I always tend to want to walk in parks because basically it brings those cortisols level down. It makes me relax and it makes me feel like I can conquer the world after I finish those walks. So it's very important that that people understand that these gems of parks and trails are available to them. Uh, One of the things that I've noticed though with Men on the Move also is that uh, not only does it help to be physically active, there's a social connection that goes along with it as well. You will be amazed at the friendships and the connections that people make with these walks that we hold on a monthly basis. Uh, no one wants to feel alone. No one wants to feel depressed. But I feel these walks are one of the ways that we can help combat those issues by bringing people together as community, and also we can learn together, we can grow together, and we can extend beyond just the walk. So those things are really important as well. As an outgrowth of Men on the Move, we are able to do talks. When we do Men on the Move, we have a 30-minute walk. That's why I asked everybody to do 30-minute walk. But also, we asked someone to come in and talk about a health topic. The health topic is generally 5 to 10 minutes. And what we're trying to do is really spur on an interest. So if someone comes in for 5 to 10 minutes and want to talk about uh, colonoscopies and things like that, we're hoping that it will spur on something that we can have a seminar on or a webinar on, so we can host those little things where they can get more in depth with the conversation. So that's one of the benefits of Men on the Move also. We spur on interest of health topics that people need to hear about. Um, Another thing we is outgrowth of Men on the Move is that we work with the Duke Cancer Institute. One of the things that the Duke Cancer Institute is offer free screenings in the month of September or whenever they decide they do it, but usually it's in September. Uh, we as the Men's Health Council help greet the men as they come in for those health screenings. So the first thing that they want men to see is other men greeting them. So that's part of what the Men's Health Council does. We greet these men as they come in, and sometimes their wives are with them or significant others are with them. So we greet them, we talk with them, we share information about what the health screenings will look like, and it's a way of making them feel uh, relaxed and calm as they about to go through this process of getting these different health screenings. Um, Trying to think, is anything else really? One of the things also, I think we need to understand also, the 30 minutes that we do on that Saturday is just really a precursor. What we encourage men to do and their families and friends is to get 150 minutes in a week of some aerobics of some type of aerobics exercise. And again, what I said earlier, the easiest thing you can do is walk in your neighborhood. Uh, we hope to expand some other stuff later on. One time we opened it up and had bikes out there, so we're hoping to maybe in the future really have bikes out there for people who want to maybe step it up a level, and we have people who want to run. So we don't frown upon that. If you want to move, you just move, and you move in a way that you feel comfortable with. Uh, and I'll end with this. Mark Twain said something like Mark Twain stated something kind of funny. He said the way you stay healthy is to eat what you don't want to eat, drink what you don't like, and do what you don't want to do. And that's not what we're trying to do. The best thing what we need to do is really have a happy zone. So you find the things that energize you. You find the things you find a happy medium. You find the things that energize you. You find the things that going to make you feel healthier, going to make you have some equilibrium with your mental as well as your physical. So those are the things that we're trying to do. We're not trying to make you do things that you dislike. We want you to find the things that you enjoy, and we work with those things that we enjoy. Thank you, and I'll turn this over to Bradley.
Hello, everyone. So I am
Bradley, I
Bradley.
have your picture up.
Okay, the guy in the plaid shirt. I'm not the clergy, but I'm Bradley, the vice chair. One of the um, things that I can say about the health council is that the walks really bring the men, really bring us together as a group, because it's um, a time we all walk in doing the same thing, talking about whatever's important to us, and it really brings us together as men. Um, I cannot remember how I got involved with the health council, but I do know, I do remember one of the first things I can remember is the walks and meeting we had a seminar one evening with a Black cardiologist, and he was just fascinating to me. I saw someone who was uh, a doctor and looked like me. So it was very important when we got in to find doctors to me that represented me, somebody that looked like me. And that's one of the things I think we really do well. Um, what else can I say about the Men's Health Council? Again, as Jeff said, we work with quite a few groups. We do a lot of stuff with Duke and the Cancer Center. I've done a lot of stuff with the Cancer Center personally, being a prostate cancer survivor. Um, I don't think I would have been able to go through this without the men in this organization, because they really stepped up when I talked about having prostate cancer. And I think they opened the door for a lot of other men to talk about having prostate cancer as well. So it's
Bradley,
important.
tell them about the prostate support group that you help facilitate.
Oh yeah, so we do have one of the members in the group had a prostate support group at Lincoln, and after COVID, that group did not start back. So we have started a group that meets the fourth Thursday of the month at WD Hill, and we talk about prostate cancer and have people come in and talk and things of that nature. So it's something we've just started, maybe about 2 months, 3 months now. Still in the process of getting everything together, but we do have people to come, and we do share different things about prostate cancer and other topics. I think a month before last, we had men's mental health. Dr. Hatch came in and talked to us about the mental health of men and uh, how that affects us. So we do quite a bit of stuff with the Men's Health Council. I'm just happy to be a part of it.
And I'm happy you're a part of it, Bradley. I do remember how you got involved. I came to a Christmas party, and
Yeah,
it was
yeah,
at
right,
this nice home, and
right.
Bradley opened the door, and I thought Bradley was the butler because he was so sophisticated and so polished. I thought, whoa, they can afford a butler. Who are these people?
Right,
And
right. I remember that
that was
story.
Bradley Long, but that's what Bradley is, and Bradley facilitates many things. He continues to do that. So um, if you need someone who knows how to do it appropriately, you should call on Bradley. Bradley had the idea, I guess, and Jeff, we give gift cards, which we got donated. But Bradley bought a bunch of gifts in one year for the Men's Health Month walk,
Right.
and he had them all set up, and people loved it. And those were donated by Bradley. He knows how to celebrate. And he's also involved in many church activities because he's an usher. He's on the usher board for the city, and he brings in a lot of folks that way as well.
Right.
Thank you, Bradley.
You're welcome.
Hey Joyce, I want to
Yes.
note one thing. Hey Joyce, if I can say one
Yes,
thing.
please.
One of the things you talked about with Men on the Move was the green shirts. I just want to let people know how they can earn a green shirt.
Yeah.
I always mention that at the Men on the Move walks. The way you earn a green shirt is that you walk 3 times within a year period, and after that third time, you will get a shirt.
Yeah, they
And believe me, people want to earn it also. So yeah,
Absolutely.
they just don't want you to hand them one. They want to earn it.
mm-hmm,
And they make
mm-hmm.
sure you know they have been there for 3 walks and they want their shirt.
Yes. Dr. Jenkins, I think Dr. Jenkins, Rodney Jenkins earned his shirt. Well, he earned his shirt for
Yes, he
many
did.
reasons.
Yes, he did. He did.
He had, I know he has one, and these are really nice shirts. Dr. Jenkins joins us on our walks, and he also has been a presenter at our more than once at our
Oh yes.
sessions. At every Men's Health Council meeting, we usually meet as a group a couple times a year, and the men get to hear what we've been doing. We have a guest speaker on some topic that's health related, and we also have a meal, and that's always fun to break bread. One of the things that many of the studies have shown is how people doing good for others makes a huge difference in their life expectancy, in their state of health, and in their mental health. And we've seen that happening with the Men's Health Council. And as I said, the coming together once a month, networking means so much. It's an expectation. And if you don't come, people start calling. Well, where were you? What happened to him? Or they call me, Joyce, where is such and such a person? And we've had some members affected by the flood recent. And folks were worried about where are our members. I've got to call one person this afternoon because didn't think about it, but his home was flooded, and we have resources. We don't have resources, but many people know how to connect each other to resources. So someone called me and said, Joyce, tell this person that here are some resources that they can use. One council member helping another council member. Thank you, Dudley. Thank you, Bradley. Thank you, Jeff. I'm going to turn it back over to Alicia and Don Dudley.
Thank you, Joyce. Thank you, Bradley. And thank you, Jeffrey. This is a great presentation. And I'm hoping that our audience today has questions. I know I learned a lot. I had a couple questions myself. While on the call, I downloaded the flyer and I sent it to my husband. And I told him I want him to join the group. So I appreciate the information and everyone's participation today. So if there are any questions, feel free to either drop them in the chat or you can open your mic and ask questions. And we would love to hear from you. No questions too big or too small. Well, while we wait, I'll ask my question. I'm curious what the average age of your participants is and what has been your youngest and your oldest participant?
Mm.
The age of your oldest and youngest participant.
Oh, that's a good question. Our youngest participant has been, right now, I think Dalen, I think Dalen just turned 3 or 4. But when she came, she was not walking. So she was under a year. And she comes with her father almost every month. The oldest participant is in his 80s. And I'm not sure if he's 85 or 86 now, but that's the oldest participant. I may be wrong. We have some ladies that come who told me they were in their 80s and yes, but that's one of the things we do is when someone comes to a men's health walk, we give them a sheet and we ask them if they would give their email address if they don't mind, their zip code so we'll know where people are coming from, and their age. And we have several people who are over the age of 80 who participate, and the majority of the people who attend our sessions are between the ages of 40 and 60. But we have, and that's one of the things that the men have said they want to happen. They want to get younger men involved, and they want to share their stories with younger men because they want to be mentors. They say it makes a huge difference to them that someone told them how to navigate things, and they want to do that. So that's one of the things that we have on our agenda for the upcoming year.
And Joyce,
Thank
if
you
I
for
can
asking.
add, Joyce, if I can add something as well. One of the things as with the Men on the Move also is I told you it's a family thing. So my son, who is a recent graduate of UNC Chapel Hill, he's exercise science. He graduated with exercise science degree. One of the things that he does is he warms us up before we walk. He's 21 years old, so hopefully, through my efforts, I am spurring something on in him that he will carry on through his lifetime as well. So as part of that youth movement, hopefully it can start with my son.
Yeah, Daniel is his son, and I call him Daniel's son because I feel like he's my son too. But Daniel often has come to our walks, and when he comes to our walks, he once had to go find a few of the older members who were tagging back along, but they were not with the group. And so we looked up, and Daniel was waiting, and I was part of that older group. So Daniel had come to see what happened to us. But one of our members had tripped over something. He didn't hurt himself, but he tripped, and so he decided, we said, okay, Lena, we need to walk slower. We do ask you to sign liability clause that says we are not responsible if anything happens, that everybody's walking on their own. No one's ever done anything to say that we were responsible, but we do make it clear that when you come to the walks, you take responsibility for your health and safety. And Jeff makes sure that you're in a safe environment with the parks. And we have wonderful people like Daniel who make sure we are okay. So that's a good thing. And we have other young men. We used to have a men that we call what do we call them, Jeff? The sons of the Men's Health Council.
Men's Health Council, yeah.
Yeah. And they have
yeah.
they graduated, but they were a lot of fun to have with us and volunteer. And we have women groups of the AKAs have asked if they can be a regular part of our group. They come in and they help us set up, and they walk, and they bring their spouses or family members.
Thank you for your responses.
I hope your husband will come, and I hope you will come with him.
Right.
Was that
I'll
was
send-
Alicia, right? Or was that Dawn?
It was me. It was me.
That was you, Dawn.
And I go to doctor's appointments. If I don't go to doctor's appointments, I prep him with his set of questions he's supposed to take. So I definitely am a part of that. And the same with my father and my brother. They don't live in this county, but I am very aware of the role that women play in men's health. I have a son as well. And I, of course, am involved. He's a minor. So, but I'm certain I'll be on his list, his contact list too. Even after he becomes an adult. And he probably will be the person who will attend my husband first. I think it'd be a great bonding activity for them. But I want to make sure that I go to the questions, the chat, because we have 3 questions right now, and I want to make sure we get to them. The first question is, do we have any plans, are there any plans in the future to start a men's health in Espanol for our Spanish community?
That's a great question. And that's something that's needed. I do not currently have a plan to do that. We tried in the very beginning to combine persons who were Spanish speaking and with African American targeted population. And we had some men from different, we had men, I think, from Mexico, maybe El Salvador, that were participating with us and with some of the organization and one of the staff members. It didn't work successfully, not because there was not any positivity for it, but because those men had so many responsibilities that and they moved along they quickly went into new positions. They were sought after. So and it was hard to do it in Spanish and in English.
We just hadn't had
That's
the
something that needs to be revisited. Where
yeah,
is
we haven't had the
yes.
representation from the Spanish community really. So we could if we had that population, but we just have not had the Spanish people to the Spanish men to come out and attend a lot of the events. So
And
we're more than happy
they
to
are
have them.
invited.
Yeah,
What did you say, Bradley?
I said we're more than happy to have them.
We would love for them to come.
Yeah.
We would absolutely love it. And we also need to look at that. So that is an area to pursue. How can you do that? Because you do need someone who's a Spanish speaker to take a lead on that.
Yeah,
Thank you
sometimes.
for asking. That's a great question. And I'm going to put that back into the administration here and ask our administrators here in public health if there's something we can do now. And I see Yvonne Redisa, who's my colleague, and Yvonne has been very helpful with representing Spanish-speaking populations and speaking because she's a Spanish speaker as well. She's bilingual. She helps me a lot, and she's here to continue that. Thank you for that question. We're going to follow up with that one.
And the person who asked that, I know they're very involved in the community. And so I think that, I don't know if that person was volunteering to be involved, but
Was that Oscar?
yes, that was Oscar.
Oh,
So those who know
yeah.
Oscar know that he is very connected to the community, loves the community, knows the, the value of public service as well. So hopefully you all will be able to have a connection to just even have the discussion further.
Yeah,
We look forward to talking to
Oscar
you,
would be
Oscar.
fabulous.
Right. We
Yeah,
look
he
forward to
would
talking
be.
to you, Oscar. And thank you to Rodney Jenkins for all your support.
Shout out to
Yeah.
Rod. Shout out to Rod.
Well, yeah, we
Yes.
can't thank Rodney Jenkins enough because we couldn't do this without his support.
Correct.
That's great.
Absolutely.
Happy to help. This is my tribe. Happy to help y'all.
Thank you.
That's great. I want to move on to the second question that we have here. Is, are there unique challenges or opportunities that come with focusing specifically on men's health?
What did
I
you
think
say? Would you
I can
repeat
ask-
that?
No problem. Are there unique challenges or opportunities that come with focusing specifically on men's health?
I feel that lots of oftentimes women's health is always in the forefront. So with this organization, we're focusing on men's health, and a lot of things that we're talking about transfers to everybody's health. Prostate cancer is only for men, but a lot of other things that we talk about too deal with everybody in general. So I think this is a time where men get to shine. In the Men's Health Council, we get to shine and talk about things that are important to men in general.
Mhm. There are unique challenges for focusing on primarily on men's health, and that is getting men to come, getting them to come and participate, and that's why we are focusing on men. My focus is not just on men, but part of it is with the Men's Health Council. But the work that I do here at the health department focuses on chronic disease self-management, chronic disease prevention, and falls prevention. We've started focusing specifically on men because we were having such a hard time getting men to attend our activities. Now we don't have that problem. So that was a challenge, but it means you got to get men. What we found is that if men are leading, which they seem very comfortable doing, if men are in leadership roles and they have responsibilities, they want to be involved and they want to be part of these issues. It is identifying right person, the person who wears the right hat. So if I want to reach out to a group of men, I need to have a male, in many cases, be with me and open that door for me. If I want to reach out to doctors to come and get involved, I need to ask the doctor, will you contact someone, this particular doctor? Do you have a doctor in a specific field that you will contact and tell them that I want to have them be a part? Or can I use your name? And once I use their name and say, this is Joyce Page, Dr. Holly Baula asked me to give you a call. She said she thought you would be interested. Interestingly, also, we're having doctors come to us and ask us if they can present. They're volunteering. They want to do it. They say they want to take the information out of the institution and put it into the community. And we are a vehicle for doing that. Jacob, are you telling Jacob, are you interested in working with the Men's Health Council? Yes. Thank
Joyce,
you.
you're about putting people on the spot.
Sorry, I
Oh,
was on mute. Yeah, I think so. Sounds interesting.
I
yes.
think what's also, you asked the question about there's challenges. I think there's challenges in our mindset also. I tend to want to be independent, strong, thinking that, if I have a sniffle that I'll just linger, let it linger and stuff like that. I think it's important to have a men's health council because basically you can identify with other men who might be going through the same thing. So once you build that community and you kind of express the things that you might be going through, others can share and give you the courage, the confidence, and the advocacy to advocate for yourself with your health issues.
And that's one of the things I think that really inspired me about the Men's Health Council. It gave me the voice to uh, speak for myself. A lot of times we go to the doctor and we just listen to whatever the doctor tells us and don't really understand and don't ask questions. And we'll get home and we'll ask somebody, what does this mean? Or what should I have done? And that kind of thing. So I think coming to these meetings, I think men learn to speak for themselves. They learn to, and also talk amongst us because we all go through a lot of the same problems and challenges. And so if you don't talk about it, you never know what's going on and how somebody else in this or somebody else can help you. And that's one thing about Black men. We like to go through things alone a lot of times. So I think this
Yeah,
group gives us the
suffer.
opportunity
Yeah,
to,
yeah, suffer in
we,
silence. Yeah,
right,
yeah,
right. We
suffer in
suffer in
silence. We don't
right.
want to do that. Yeah.
Yeah, I'm
Okay.
amazed at how open the men are because I expected men to be much more closed. But when they come into these meetings and they sit and feel comfortable because they know people care about them and that's our purpose is to help them, they're very open and willing to share what their concerns are. And one of the our participants told another man that he had to stop seeing his doctor because he was taking too much of her time. But that was, that was Willie. And Dr. Viola comes from Lincoln Community Health Center, and she makes almost all of the walks. And Holly Viola, she's the chief of family medicine at Lincoln Community Health Center. She cares about her patients, and she will help them navigate to where they need to be. And there was a joke that Willie said, you told another member, because he was talking to her during the walks, and then you've talked to her long enough. You're taking too much of her time, but she loves that. And we have Dr. Coleman when he comes, and Dr. Wilder. Oh, let me tell you, Dr. Wilder gave a presentation on gastroenterology. Someone saw it in our flyer. She lives in Florida. She couldn't be there, so she called me and said, "Do you think he would? You could ask him this question for me." So I didn't ask the question, but I asked, will you answer? And he got on the phone with her and he had a detailed and visit with her and gave her great advice. She was so happy. But these are the type of people that we have working with the Men's Health Council as volunteers. And we have staff members who have joined. I know Dante is a member and Dion have joined, and Dennis Hamlet have joined the Men's Health Council and helped and presented. we would love to have more of the men from Durham County, Oscar and Jacob, to join us because it's a program for all men and women.
And one of the
Thank you,
questions
Jeff.
about younger men generation going to the doctor, I think that's going to have to be a part of something that they're going to. One of the things I had my primary care physician, one of the sessions come and talk about just general stuff, you know, and going to
He was
the doctor.
good.
And so I think a lot of times men need to get a primary care physician, you know, to start just annual physical. So one of the things that you could start, and those things really help you when it comes to looking at diseases. You know, a lot of times had I not gone to the doctor on a regular, I don't know when my prostate cancer diagnosis may have been diagnosed. You know, now I was in very early stages when I was diagnosed because I went to the doctor quite a bit, and so I caught the prostate cancer at a very very early stage. So I think, you know, just going to the doctor, but a lot of times younger people, especially guys, if they don't have to go to the doctor, they don't go, and so that's something that we really need to work on getting younger men to go to the doctor.
Bradley, thank you for jumping in and answering that question. Jeffrey or Joyce, do y'all have anything to contribute to that question about any recommendations on screening younger men, starting checks to be proactive on their health? Please do. I want to make sure I let you know that we have about 4 minutes left. And in addition to that question, the other question was, is the third Saturday the only time you have these walks? So I just want to make sure you all have time if you want to comment on those as we're wrapping up.
Yes, that's the only time we have the walks, and that's the reason. The reason is because of my schedule. That fits my schedule. Now, if somebody wanted to join in and do some other things, it could be more Saturdays, but that fits my schedule. Also, I didn't want the walks to be I don't know. I didn't want it to feel like it was a burden for people. People live busy schedules, so I wanted to make sure, hey, we can at least come out once a month to do this to model healthy behavior to our community. It's really, like I said before, it's really impetus for you to do it on your own. We're just modeling it that Saturday.
Yeah, absolutely. It's a known fact that some of the people who come and walk with us walk with each other during the week. We
Outside.
have
During the
some that
week,
go
correct?
to one of the recreation center, one of the indoor
Yeah,
walk
Walltown. They go to
walk.
Walltown, huh?
Time.
Yeah,
Right. Well,
Walltown Recreation Center has
And there's
indoor
some in their
walking track.
community that they are doing it. That's what we do. We encourage self-management. So we can't do the walks. There's a cost for doing the walks, the setups, the responsibility for making sure everybody gets a form signed and that you have refreshments there, a location in the announcements. Not that that's a bad thing to do. None of that's bad, but it just means that you have to have maybe more people than me. And Jeff takes the lead, and I send out the information and gather the data. So we encourage people to continue to do it, and that might be something that someone else would want to take on and say, you know, we're going to meet at this particular location because we do have members who call each other and they meet at another location and they walk because that's a good thing
and
to
you,
do.
and you never know who's going to be at these walks because you might have a dentist there. We might have a healthy cooking class. So after you walk, you got somebody that's cooking some healthy food for you. There's a lot of stuff that go on after the walks
Mm-hmm.
or before the walk.
Mm-hmm.
So, you know,
Mm-hmm. Mm-hmm.
come out.
Wonderful. Well, thank you all so much for this, and I hope that you will drop your email addresses in the chat. I know that Alicia already shared your contact information, Joyce, but Bradley or Jeffrey, if you want to share your information, please do. And I'm going to let Alicia close us out because we have come to the end. This hour has gone by very, very quickly.
Yes, thank you all. Thank you, Bradley, Joyce, and Jeff, for joining us today to talk about this important topic. I hope that you see some new faces from this presentation. some of your walks or events. So we do have a My DCo page for DCo Talks. That is where we post the recordings. This will also be found on the official Durham County YouTube page, but it will be posted also on this page. And also look for the next edition of News You Can Use, a link to the recording. And we will talk with our presenters today to get any other important information to share out to you guys. So we have a survey that I will put in the chat. Like Dawn said in the beginning, this topic of men's health actually came about from someone who took the survey and wanted us to bring this as a topic for a DCo Talk session. So if you could please take that survey, it means a lot to us with getting topics that interest you. And I am not going to take up too much of you guys' times. Dawn, do you want to close it out?
Yeah, thank you again for everyone's attendance. We hope that you will continue to follow us here at DCo Talks, and we may have another men's health conversation sooner than later. So be on the lookout for that because it seems like it's a very interesting topic based upon our numbers today. So Joyce, Bradley, Jeffrey, thank you for your time, your contribution to our community, and for you sharing information today in this space. I hope that everyone has a wonderful day and try your very, very best to stay cool.
Thank you
for
so
having us.
much.
Thank you.
Thank you.
Bye,
Bye-bye.
everybody.
Bye.
Bye.